For a number of years, the ACR birads lexicon has been used to assist mammographers in describing the mammographic features of breast lesions. Recently, a lexicon for the description of breast ultrasound features has been created by the American College of Radiology, birads ultrasound. This is an important addition in view of the growing use of ultrasound as a complement to mammography in the evaluation of breast lesions. The rationale for the development of the lexicon is based on the fact that up to 10% of patients referred for mammography have masses which may be found to benefit from ultrasound evaluation. Lesion features shown with ultrasound may be used, therefore, to formulate a combined assessment category and management recommendation. The birads lexicon forms a basis from which these descriptors and assessment categories may be derived. Currently, the indications for breast ultrasound include the evaluation of equivocal masses noted on mammography. In this case, a large mass is seen in the subareolar region. On evaluation, this was initially felt to be a cyst, and aspiration was performed, returning a large amount of cyst fluid. After aspiration, however, a small mass was still felt. For this reason, ultrasound was performed. The ultrasound shows, in addition to the partially drained cyst, a solid mass with features suspicious for cancer. Biopsy confirmed a high-grade breast cancer. Another indication for breast ultrasound is in the evaluation of palpable masses in young women less than 30 years of age. In this case, the palpable lesion shows benign features, and upon biopsy was proven to be a benign fibroadenoma. When biopsy is indicated, ultrasound is perhaps the most convenient and rapid means of providing localization for needle biopsy of breast masses, and this remains an important practical application of breast ultrasound. Ultrasound is also used in the evaluation of breast implants and may complement magnetic resonance imaging and other methods in the assessment of implant rupture. The breast imaging reporting and data system now includes a lexicon for the description of not only mammographic features, but ultrasound and breast MRI imaging. The ultrasound lexicon was developed by a team including Drs. Ellen Mendelsohn, Janet Baum, Wendy Berg, Christopher Merritt, and Ava Rubin. The lexicon is intended to assist users in applying standardized descriptors to characterize and report sonographic findings of breast pathology. The combined mammographic and ultrasound reports are then intended to lead to the assignment of an assessment category and appropriate management recommendation. The lexicon incorporates terms to describe important diagnostic features of breast lesions. These include the size, shape, margin features, orientation, and attenuation characteristics of a mass. In addition, the lexicon includes descriptors of the architectural pattern and fibroglandular echogenicity and fat echogenicity. Diagnostic features also include indirect signs that may be associated with cancers, including changes in the Cooper's ligaments, calcifications, skin thickness, and ductal alterations. Breast pathology encompasses a broad range of benign as well as malignant lesions. Benign lesions include simple cysts, skin lesions, dilated ducts, intramammary lymph nodes, foreign bodies, including siliconomas, and edema. Over the years, a number of criteria have been established that aid in the identification of benign lesions, that is, masses with a less than 2% risk of malignancy. These include an ovoid shape, the presence of 2 or 3 gentle lobulations, circumscribed linear and well-defined margins, homogeneous echotexture, edge shadowing, an orientation of the long axis of the mass parallel to the skin, distal acoustical enhancement, lesions that are uniformly hyperechoic relative to fat, and the absence of any suspicious features. Features associated with malignant lesions include irregular shapes, poorly defined margins, central shadowing, architectural distortion, and orientation of the long axis of the lesion parallel to the skin, as well as heterogeneous echotexture. The birads ultrasound lexicon includes specific terms to describe many of these features, including the background echotexture, numerous features of the mass, as well as changes in surrounding tissues, calcifications, and vascularity. Background echotexture should be described as homogeneous or heterogeneous, and if homogeneous, the predominant pattern of fat or fibroglandular tissue is included. In this example, the background is homogeneous and is composed primarily of fat. In this example, a homogeneous background composed of fibroglandular tissue is present. And in this example, the background is heterogeneous, composed of a mixture of fatty and fibroglandular elements. The most important characteristics and terms relate to the mass identified with ultrasound within the breast. A mass is defined as a space-occupying lesion which is visible in two different projections. Masses must be distinguished from normal structures such as ribs or fat lobules using two or more projections, as well as real-time scanning. The first characteristic of the mass that should be described is the shape, and the lexicon includes three descriptors: oval, round, and irregular. An oval mass is elliptical or egg-shaped. This includes masses that have two or three gentle undulations or lobulations. In this example, a typical benign oval mass is shown, a benign fibroadenoma. Here, transverse and sagittal views of an additional mass with oval shape, also a fibroadenoma. A round mass is spherical, ball-shaped, circular, or globular, with an anterior, posterior, and transverse diameters which are equal. Round lesions include cysts, shown on the top, as well as the homogeneous small cancer shown in the bottom pair of images.